Gwen Schmidt was only 21 years old when she was diagnosed with stage 4 colorectal cancer. Her chance of survival, just 5%.
I was scared, completely terrified. I mean, it was like everything that I'd known up until that point was just gone almost in an instant.
She beat the odds and survived, but then her toughest battle yet.
People think that once you finish treatment, you're done, you're good, you're golden. And I will say that once you finish the active treatment, the surgeries, the chemo, that's when the hardest part comes. And you have to sit with yourself and you have to sit with your new reality and figure out, what does that look like now?
Gwen was left with devastating physical and emotional side effects from not just her cancer, but its toxic treatment. Globally, more than 1 million people ages 15 to 39 are diagnosed with cancer each year. And thanks to better treatments, survival rates keep improving. But that also means more young people are now dealing with the aftermath of the disease. Dr. Stacy Sanford is co-director of Northwestern Medicine's Adolescent and Young Adult Cancer Program, one of a growing group of programs created to help these young survivors.
They might be at risk of cardiac concerns or pulmonary concerns, or maybe even at risk for secondary cancers as a result of their treatment.
One study found that young adult cancer survivors have a higher risk of 24 health problems, including heart failure, kidney and liver disease, hearing loss, and even stroke. They're also more likely to have psychological distress than older adults diagnosed with cancer.
I couldn't look too far into the future because I didn't know what the future was going to be, if it was going to be.
While a main focus of the program is helping patients with health problems that can be missed at regular doctor's visits, they also help with social impacts, everything from school to careers and even love.
If I'm dating, how do I disclose this huge thing that happened to me?
For Gwen, she needed help navigating how to have a child since her treatments destroyed her fertility.
And it wasn't until after so many surgeries that I realized I wouldn't be able to carry a child either.
With aid and support from the experts at Northwestern's program, Gwen and husband Noah were able to use surrogacy to have a baby girl, Vivian.
You're finally in a room with a bunch of people who just get it. They understand the feelings, the fears, just the crazy roller coaster cycle that it is to be diagnosed as a young adult.
Now, finally winning her decades-long fight.
Did you ever think you'd be here?
No. I honestly didn't. I did not think I would be alive long enough to get married and start a family.
And with us now is Dr. Akshay Syal. Dr. Syal, such a striking contrast of two intense feelings at once. You've got relief on one hand, you've got fear on the other hand. I can't imagine what that's like, especially for people who are just starting their adult lives there. I know you've found a few young adult cancer programs around the country. What are they telling you about that internal struggle?
Yeah, Gotti. I mean, this is a problem. I mean, these are people our age, in that 15 to 39-year-old age group who are having their lives on hold. I mean, these are people who should be out dating, starting schools, entering the workforce, and all of a sudden they're left to confront this battle. And as people often say, you beat cancer, now what? And it's a greater focus on that what, especially for the young adults. And how do they, we want them to have many more decades to live. And how do we keep doing that? By managing them, by surveilling them, and making sure that they're getting regular screenings. And it's really a different set of advice for these young adults as it is for somebody who's diagnosed at maybe 65 or even somebody who's diagnosed at age 8. So it's a really separate set of issue here, Gotti.
And we heard a little bit of this in that piece, this feeling of loneliness, and then finally this feeling of relief when you can talk to other people that know what you're going through. Can you tell us a little bit about that part of recovery?
Yeah, so, in talking to Gwen about this, it's you're going to the appointments and you're sitting in the waiting room, and who do you see around you in the waiting room? Do you want to see somebody who looks like your grandfather, or do you want to see somebody who looks like you? And it's really building this sense of community for young adults. A lot of programs, it's Northwestern, it's Stanford, it's Mass General in Boston, are using these Instagram accounts, these Twitter accounts, these Facebook accounts to kind of help build this support for young adults, to make them feel like you're not alone. There are other people who are going through this. You got this. We're here to help you. We're here for anything you need. And you see it really make a difference in these patients, Gotti.
Yeah, and you want to see more people cured of cancer, but you always want to remember that the job is not done once cancer goes into remission or goes away. Dr. Syal, thank you so much for such an important reminder.
Anytime.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.